All right, thank you. We'll go ahead and start our speech language pathology practice committee meeting. It is May 15th at 3:28 p.m. I'll start with our roll call. First on the list is myself, Gilda Dominguez, committee chair, and I am located at the Galeras Family Education Center at 427 West Carroll Avenue, room 2 in Glendora, California, 91741. And also Dr. Tamara Chambers.
Here.
And she is located here with me at the same location. And we have a quorum. I'd like to start with agenda item number 2, public comment for items not on the agenda. I'd like to ask the moderator to open public comment on WebEx at this time.
We are open for public comment for items not on the agenda. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand. And for our mobile device users, you may need to hit the ellipses button, that's the ... and cycle through the 3 different pages in order to find your hand. People will be given 3 minutes to speak, and I'll give you a 30-second warning before your time expires. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request, you wish to continue with the agenda?
Yes, please. Thank you. Moving on to agenda item 3, discussion and possible action to amend regulations regarding scope of responsibility, duties and functions of speech language pathology assistants as stated in Title 16 CCR section 1399.170.3. I'd like to now ask Ms. Lorenzo to present this agenda item.
Public comment. This is Yuping Lin Board Council. Just as a notice, we are at the response board location. There's no members of the public for public comment at this time, so we can go ahead and move on.
And does Ms. Chang, you don't have any members of the public for public comment at this time either, correct?
No, I don't have any members here with me.
Thank you.
Thank you.
And we don't either. We don't either. Thank you.
Thank you.
Thank you, Ms. Dominguez. On November 30th, 2023, the Speech Language Pathology Practice Committee discussed restrictions on SLPAs regarding the performance of oropharyngeal swallow therapy with bolus material. At its December 5th, 2023 meeting, the committee reviewed and discussed SLPA practice restrictions in neighboring states and the scope of practice for both the occupational therapy assistant and physical therapy assistant. The committee directed board to provide more information on the following questions. Are SLPA programs offering courses that include swallowing disorder and feeding? What is the role of OTAs under the supervision of an occupational therapist with advanced practice in swallowing assessment, evaluation, or intervention? Are OTAs program offering courses that include swallowing assessment, evaluation, and intervention? And do occupational therapists need to be registered with the board as a SLP aide when they're operating under the supervision of a SLP for the purpose of fulfilling the 240 hours of experience required to obtain the advanced practice certification in swallowing assessment, intervention, and evaluation? Board staff reviews SLPA program curriculum, and no SLPA program is offering courses that include swallowing disorder and feeding, nor are they being offered in bachelor's degree programs. According to the California Board of Occupational Therapy, OTAs are permitted to provide services in swallowing assessment, evaluation, or intervention if their supervisor is approved for advanced practice by their board. There are no training or competency requirements for OTAs to provide such services. However, since 2020, OTA programs are providing instructions in dysphagia, which gives the OTA the ability to demonstrate service and train others to provide services in swallowing assessment, evaluation, and intervention. Specifically, OTA programs must meet the accreditation standard provided there in the memo. Occupations under the supervision of SLPs do need to be registered with the board as a SLP aide if they're fulfilling the 240 hours of experience required to obtain an advanced practice certification under the speech language pathologist. The Board of Occupational Therapy reports that most applicants are not accruing their hours under the supervision of SLP. And so if the committee wished to remove restriction on SLPs performing the oral phalangeal swallow therapy with bolus material, we have provided questions for discussions to consider to ensure consumer protection. Are there any,
Oh, go
are there
ahead.
any questions with the information provided?
I'm sorry, what did you say just now?
Are there any questions on the information provided?
This is lofty as well. And there's a lot of information and there's a lot of aspects to this, but I feel that this conversation should still continue with the understanding that we are keeping consumer protection first and foremost and in mind. With regard to the responses, SLPA programs are not offering courses that include swallowing disorders and feeding, but you're saying the OTA coursework does include that.
That's correct.
And I also read in some of the documentation that there are the occupational therapists with advanced practice who are also able to be involved in instrumental assessments. I'm just looking through a lot of the documentation here. With the advanced level practice skills, they may develop skills for instrumental evaluation relevant to their area of practice. They include or not limited to video fluoroscopy, cervical auscultation, fiber optic endoscopy, and other instrumental evaluations. And the advanced level occupational therapy assistants can assist the OT in carrying out instrumental swallowing evaluations. So I just wanted to make a comment that is also notated in here. And again, I'm keeping in mind the consumer protection. However, I also want to have this discussion to see if are we as a profession self-limiting ourselves when another profession is working with feeding, swallowing, eating, as they have these terms that deal with activities of daily living. So I also saw that we may be going against the grain with this. However, I do think there needs to be some consideration on, okay, how can we have this discussion including swallowing in the SLPA's scope of practice appropriately and safely. I noticed and thank you for pulling all this information together with the other states. Again, as I said, I feel like we're going against the grain, but I think when you are looking at all of the things that OT can do, that it's worth the discussion. ASHA has some statements too that state that the SLP should not engage in any of the following activities. And there is a phrase that we also use at our state level: performing procedures that require specialized knowledge and training. For example, vocal tract prosthesis, shaping or fitting, and vocal tract imaging, but they do not include the phrase that we use at our level, oropharyngeal swallow therapy with bolus material. However, higher up in the list that you have in the attachments, they include that the SLPA should not participate in administering or interpreting feeding and or swallowing screenings, checklists, and assessments, or developing and determining the feeding and or swallowing strategies or precautions for students, patients, and clients. To that point, SLPAs would be following a plan of care that has already been established by a speech language pathologist, and not altering the plan of care because that is not in their purview. So and speaking personally, again, I know Sharice, you mentioned this term, are we limiting, right? Is it self-limiting? Is it something that we should consider, even though ASHA says there's aspects of swallowing disorders that the SLPAs cannot treat, but if they are following a current treatment plan, is that a discussion that I know we're, state licensing board is not ASHA. ASHA is not the state licensing board, but they overlap with us as we are issuing licenses, but they're also issuing certifications. So we don't want to cause an issue on that end. So would it be worth having a conversation with ASHA, since we seem to be on paper going against the grain of what other states are doing, to actually discuss the operational definitions and the limitations that they have set forth in a document.
I think there's a big difference between maybe what exists and what could be. So because of the way the original SLPA curriculum and all the rest of it was set up, it was very much about speech therapy and not so much about swallowing therapies. And so therefore, the curriculum, it doesn't seem from our review, is not more towards the swallowing and swallowing therapies. And it's just not integrated in at this moment, because that's not how it was created long ago, right? It's not currently incorporated in there. It's not part of any accreditation standards for them, and that it just doesn't exist right now. So it's not, I mean, it looks like from when I'm looking at, and again, we're the board, not ASHA, but it does say administering or interpreting feeding and or swallowing screenings, checklists, and assessments, as compared to, following a treatment plan and providing swallowing therapies. Those, it seems like we're talking two different things. So it's not that we're going against any guidance that they've provided. It's just that in particular doesn't look like it's talked about in there.
That's true.
The systems aren't currently set up to train and teach them about it, which is problematic because the occupational therapy assistant curriculum is developed with that in mind.
Exactly what I mean, but going against the grain is with the documentation from, Wyoming and the other states that are included in the attachments, right? How they word some certain things. Washington, for example. I think it is worth having the conversation. I'd be curious to see what members of the public have to say about this one as well, including licensed speech pathologists and assistants. But I think we're creating a barrier with not having it in our curriculum, especially with occupational therapy, considering that in their actual curriculum. So like I said, I feel like this is like a big, could be a big heavy load to carry, but I think it's worth also looking at expanding the training and the education, especially that you say that OT does have it in and their accreditation standard, and we don't. I don't know how to move forward in that aspect. Well, what do you advise?
I mean, my initial thoughts being, it would be important to engage with the SLIPA programs to find out why it's not taught, what would take for it to be included in the curriculum, and engage in that kind of a discussion. You know, we approved the providers here in the state of California that are at the community college level. We aren't doing that for the bachelor's degree programs, but if it's something that we think all SLIPAs should have as a basic competency, similar to the, you know, demonstrate or knowledge of interventions that address dysphagia and disorders of feeding and eating, you know, if that should be part of the basic curriculum, it would be worth the conversation about, is there any statutory or regulatory changes needed in order to address that? I guess the bigger question might also be, is that something all SLIPAs need to know? Or similar to how flexible endoscopic evaluation of swallowing works, is this a specialty area that some SLIPAs need to know, and they need to gain additional training and meet some minimum level of supervised procedures before they can actually perform it? So it kind of has the question that maybe the board should be discussing with the programs about, should all SLIPAs have at least some minimum level of swallowing and dysphagia education and training, or since the vast majority of SLIPAs work with therapy with children and speech therapy at schools, is it something that, similar to the fees, we need to look at as this separate specialty area that might require some minimum training and competency verification?
I do want to note, highlight that we would only be looking at SLIPA programs in California. There's SLIPA
Yes.
programs we accept outside the state. And ASHA currently does not certify programs, so there isn't really an entity overseeing SLIPA programs curriculum. So that is something to consider when you're looking at, like, well, where are we gonna want the requirements for the outside of state folks?
Absolutely.
Yeah, no, I agree. It's kind of interesting that it hasn't been part of the curriculum for all this time and how it has gone to the OT, but I think that there's an opportunity. I don't know if there's not someone who's overseeing that curriculum, I'm not really sure whose feet that would land at. But it seems like there's a lot of opportunity to try and improve their overall practice, because in my mind, it's certainly within the realm of what they would, potentially be capable of doing, once trained. And yeah, like you said, I don't know if it's for every SLIPA or if it would be for a select group if they were going to be working in certain settings, for example, like in a hospital setting, that they would be able to do to get additional certification or training as such. But I think that there's some opportunity there.
And if the assistants are partnering with a speech language pathologist, it would be to the benefit of both of them being able to talk the same language and navigate through patient care in a similar fashion. Having that same verbiage and communication and the SLIPA understanding the documentation and the goals and the treatment plan, aspiration precautions, safe swallow guidelines, risks, benefits, and knowing when to stop a session and knowing when to proceed with the session.
And that's going to improve overall safety.
Yes. Let's see.
Did we want to go through some of the discussion questions and then see where the committee moves? and then entertain some public comment, or would you
Yes,
like?
absolutely. Yes, I think that's fine. And then I did have a question though before we move to the discussion questions. With regard to, or can you explain a little bit more about the OTs who are working under the supervision of the SLP needing to be registered with the board as an aide if they're fulfilling the 240 hours? And then there's a statement here that the CBOT reports that most applicants are not accruing these 240 hours under the supervision of SLP. So how is this being addressed, and is it always applicable?
So we did meet with the executive officer from the board, and that's where we got the information. He says that they are getting their training under other OTs, and so that's why they're not
Or positions, right?
or physicians, and so that's why it's not. It doesn't sound like it's a huge issue, but we did inform him that this is a requirement that if they're looking to complete those hours, they need to register with us as a board. And
They're just not seeing that in the applications
Right.
they're processing, so. And I don't really know that that's really a concern. They are able to get that training and from other professionals, so. But that is interesting to hear that. So I don't know if at one time it was more common for them to go to SLPs for this, but they're not as much anymore.
Okay, thank you for clarifying that. Okay, so the discussion questions. Since the SLPA curriculum does not cover swallowing disorders and feeding, should SLPAs be required to demonstrate competency in order to perform this procedure? So I think we already addressed that, and that was an affirmative. I think it should be considered to add to the curriculum, like the OTA programs. So we can also have the SLPAs, again, be partners in this area with speech language pathologists. What would that look like?
so for that one, that would look like regulatory changes. I do have that as a concept that we do need to clean that up, the curriculum section. Like I said, it would only apply to board approved programs, and it's only a few. It wouldn't affect the out-of-state folks.
Okay.
Or those getting a bachelor's degree in speech language pathology or communication science disorders.
Okay.
So our preview as the board is very limited to the approved SLPA programs that we have, or the programs that we approve at the community colleges.
Wait, I'm sorry, one more time?
So the board's purview, when it comes to adding, asking something to be added to the SLPA curriculum, is really only for the community college SLPA programs that the board reviews and approves in California. Outside of that, the bachelor's degree programs in communication science disorder, speech language pathology, out-of-state SLPA programs, that's completely outside of our.
Okay, that makes sense.
The ones that are out of state though, do they at some point have to get something in state?
They can get their degree out of state and do their field work out of state, and then they just apply through the application process here in the state to get licensed.
You could potentially set a requirement of what that would look like to be able to.
And now, if you were going for a licensure requirement and saying that everyone has to have so many, we don't normally specify, like we specify what the approval requirements are for approving a community college SLPA program, but then we also set minimum standards for education for licensure purposes for a SLPA. But it would be very interesting to require the entire SLPA population to demonstrate a swallowing area, or because we don't usually normally get into the nitty gritties of the education when you're looking at SLPA programs or the degree required. Should go to that section really quick.
Sure, but if someone were to be practicing in that field or in that way, then there could be a possibility of having that so many supervised sessions
Yes, that would go more along the flexible endoscopic evaluation of swallowing model where you have to demonstrate certain competency. But like, just so that we know, when you're talking about qualifications to register as a SLPA, it's saying, you know, we're only saying an Associates of Arts of this, a bachelor's degree in speech language pathology or communication disorders from an accredited university, the accreditation by the American Council of United States programs with completion of 100 fieldwork hours. And then what's the equivalent for the fieldwork hours? So we don't get into that fine nitty gritty part of their curriculum outside of the approval of a SLPA program that's a community college-based one in California. So that's the only caveat there. But if you're saying, okay, that's fine, we'd like it to be in the SLPA programs for the community colleges, and we want that if you're going to be able to do it, then you do need to have the fees model where you demonstrate minimum competency before you can go ahead and do these things. There's that model as well. But those would be two separate tracks, right? One is the educational requirements, curriculum requirements for SLPA programs, and the other is, you know, a separate, how do we change the bolus material or swallow therapy with bolus material? And what competency requirements would we then put into regulations that say you can do it if and only these things are met?
And in my mind, that sounds like the equivalent of an advanced level occupational therapy assistant that has that additional level of knowledge and skills, right? It doesn't sound like they have to be signed off.
They don't have to be signed off because their basic curriculum includes it.
As it,
Yeah.
right?
As
Yeah.
where on the speech side, that is not the case. So a good portion of SLPAs would come in with not any education or training on this, and therefore you would want to look at, if they're not coming in with the minimum education and training on it, what do we then think is required in order for them to safely perform it?
Right.
And then what levels of supervision, so on, so forth, contraindications. The whole fees model of you can do these specified things if and only this. But those are two different tracks, whether you don't want all SLPAs to get a little minimum education on it, or and that would be a bigger conversation and engagement with the programs as well.
I think that would be a step to,
Insurmountable.
yes. And I think, I don't think it would hurt to initiate that conversation with the community college programs. And then regarding supervision, yes, I mean, would that look like so many, because I know for fees, you know, we have the first 10 and then the second 15 at minimum. Does it look like a certain number of hours or clients, patients, residents? Like, so how does, yeah, that would need to be determined if it's hours versus those served, the number of those served. And it seems like hours is how we generally do things, right? So determining a minimum number of client contact hours, because if you go procedure wise, it could be someone that doesn't have what could be a mild versus a severe or moderate. Is it oral? Is it pharyngeal? Is it oral pharyngeal? Is there an esophageal component? Is there an airway issue that you're navigating? So I do think there should be a minimum either number of hours that need to be under direct supervision, and then a documented clearance by a speech pathologist who deems them competent to be able to do sessions.
Do you mean direct or immediate where they're in the room with them?
Oh, immediate, I'm sorry, immediate. In the room, present, versus being on site.
How long do you think it would take a SLPA to learn how to safely do these procedures of therapy?
I was looking at the patterning, they say for the OT, they're asking them to, if they're, do not need to be registered, if they're fulfilling the 240 hours of experience required to obtain the advanced practice certification. I kind of liked modeling it there so that they were kind of even tiered, but if you take like the 240 and you divide it by an 8-hour workday, let's just say, you end up at 30 days, and that's about a month. So like 1 month of intensive, like kind of training of this. It does seem about appropriate, I think.
So going by those hours. Yeah. But translating that into hours, right?
Yes, that's correct. Yeah, your justification is reasonable when it comes to regulation, that because of the variety of cases that you would want to make sure that they are exposed to as many
Exactly.
type of situation.
Especially if they have no prior education.
The other aspect was also, is there any sort of training course or should there be any?
Absolutely.
guess
I
there's-
do think there should be, that's why it'd be great to talk to the community colleges to see if you can get that incorporated in some way. I mean, OT is doing it. Why are we not doing this? I'm sorry, being frontal. Why are we not doing this in schooling? If OT has a stakehold on it right now, it seems like. Not that I don't support OTs. I love OTs.
I think, like Charisse mentioned, I think when the SLPAs were created, it was mostly focused on speech therapy,
Yeah.
especially in schools.
Yep.
A lot of the impetus for creating the license type, and you're going to hear them talk about, and providing therapy to children and providing services in schools.
Right.
So a lot of the origination impetus is where that is. So it's not too surprising that it might have gotten missed. I mean,
Right.
it's also something that it makes me think of the fees, right? So it's also an add-on. So there's not everybody focuses on swallowing and dysphagia. A lot of them are SLPs in schools as well that aren't dealing with speech or swallowing. Sorry. So
And I think there's a lot of evolution to the field,
Mhm.
Over time, what you can do with fees and diagnostic services, the way that we use like cameras and flexible, just like all of these things that we can do now that I don't think that, it's evolved. So probably the roles have evolved and the opportunities I think need to evolve also.
Yes, the landscape has changed. So to that point, having the conversation and then looking, and then if they don't, working on accruing those hours under the immediate supervision, and then having that signed off each time. And then I think OTs and I guess the occupational therapy team, are they providing these in clinics, in school settings? I know when we were talking about the job postings, they were providing feeding and swallowing treatment in clinics, outpatient clinics that we saw online. So again, if there's a speech pathologist that has a private clinic, they're seeing a lot of pediatrics, there's there's clients that need feeding and swallowing therapy, then that would be an appropriate place that they could do that.
Well, and if you remember for when we talked flexible endoscopic evaluation of swallowing the fees, it's also allowed in appropriate medical settings, including clinics, facilities such as healthcare facilities licensed by the Department of Public Health, as well as hospice facilities and a medical group practice. So in that vein, they've also defined where is it safe and where do they have emergency medical backup procedures if something were to go wrong with said therapy.
And there, back to the previous point, certain payers don't recognize SLPAs as skilled clinicians, so they don't reimburse care. So, it's not like they're going to be seeing a lot of patients on, maybe in acute hospitals, right? If those patients are government funded. Patient services are government funded. But definitely clinics and schools and, who have access to calling for emergency support. That's my thought. I think we should look at where the CODAs are also doing the feeding and swallowing therapy too. And get the full list of site types. Can you hear me okay?
Yep.
Yes.
Did you want?
Okay.
It went quiet right now. Sorry. I was looking at where we are in the questions, because I guess the next part might be, what levels of supervision should be in place for this procedure for providing this therapy.
I think initially immediate, right? While they're getting those hours.
Yeah, and then once that written verification is received, at what level of supervision would it be after that?
I mean, I guess it could be maybe direct if they're more complicated, fragile patients. And if it's something that's more routine, maybe they're just working on, I don't know, a mild oral phase. Maybe that could be something that's indirect, but I think it would have to be determined based on the severity of the swallowing disorder. And that could be delineated. Even though when you see the CODA, again, I know that they do have the education. It says the CODA who is at advanced level is able to provide services to clients who are more medically fragile, whose problems or needs are more complex than those addressed by the CODA with entry-level practice skills, occupational therapy assistant with entry-level practice skills. Again, as being part of their curriculum, they're giving this this task to a OTA that has advanced level practice.
And that OTA is already coming in with knowledge and information that they're building on clinically. It's a lot harder when you don't have that, and then you're coming in. Now we're saying, okay, get these 240 hours. I think that is probably a high bar, but I still think that every case is challenging. Every case has its own nuances. So should the question, should they need the approval of their supervisor each time they perform this procedure? I mean, yeah, I think that every case needs to be, thought through. You know, I think that there's nuances and, you know, you can, I think for the safety, I think that it's important to regulate that.
So does that look like the speech language pathologist that they're working with is on site at all times or in the room at all times? What does that look like? To you, to your point.
I
Or
think
just the initial approval is what you were talking about.
Yeah, I was talking about the initial approval needs to be immediate.
yeah, I think the initial approval needs to be immediate. Should they need the approval of the supervisor each time they perform this procedure?
Is this after, is this after the hours?
After the hours. Now they can
Assistant.
help and assist in doing these procedures. Do they need approval every time that they're providing food boluses or providing contrast? I think
I
they
would say
do.
at some point, yeah.
I think they
At some
do.
level, I mean, yeah.
I think they do. They're not now a speech language pathologist.
Mhm.
So is it
And
per
I think it should be
therapy or
documented.
per patient?
I think per session.
Okay.
Per session, yeah, per session. Yeah, per session.
And they must document that.
So pretty significant guardrails.
Mhm. Yeah. But again, only following a current plan of care, not changing an aspiration precaution or a maneuver or a technique. It's what's already in place. And if what is in the current plan of care is not working, they stop the session and then they notify their supervising SLP that they stopped the session. It wasn't safe to proceed. And then that SLP can make the adjustment and again, address the patient care. So if they're only told to give a certain type of diet texture, liquid consistency, they cannot deviate from that.
Mhm,
Can't start teaching them a new maneuver or position, or
mhm.
they have to follow that. They can cue, right? They can maybe make sure they're doing the cueing, cueing the strategies, cueing the posturing, cueing the maneuver.
They're not doing this already?
They can't do anything with bolus material,
Mhm.
right? Doesn't at least they shouldn't be. I don't know if they should be.
And I think that part of this
Right
allows,
now?
because if some of them are, then it allows us to say, hey, let's regulate that and make sure that you're doing it this way in a safe manner than if people are functioning however they want to. I think that this makes, you know, putting these guardrails up allows it to be at least in a safer, more formatted fashion.
I mean, technically, if they're doing it right now and we got a complaint, they would be in trouble because
Mhm.
everything outside
Exactly.
Mhm.
Exactly.
Again, that is the difficulty being the board. We only get to act when we know about something, which usually
Exactly.
comes in the form of a complaint, so.
Exactly.
So I think I think alone, I think it's important to try and do something like that, to try and put up guardrails for what may actually be happening. At least it can be, you know, formatted. There can be levels of expectations and levels of some version of training and guardrails and supervision put around it.
And then I think the third question is a lot of, is it the same facilities? But it sounds like you said, go ahead and also look at where the codas are doing this.
Yes, yes.
My guess is much of those are the same facilities we also allow the fees to be done in.
Mm-hmm.
Well, maybe not.
looking
Again, like adult hospital settings, again, when you have CMS issues that they don't recognize the SLIPA. So I'm not quite sure about that level of care, that we even need to mention that. That's a whole different conversation.
Yeah. Sounds a little outside of my jurisdiction. Okay, so look at the code, where the codas do it, and also look at the fees. And does the requirement of having specified emergency backup procedures should also be there as well?
Yes.
The same way that it should be for the
Yes.
people that they're working with.
Mhm.
Along the same veins of the fees model, essentially, what are the contraindications where a SLPA should be prohibited from providing the therapy?
I don't think any of those.
So for in fees, I think we have the severe movement disorder, severe agitation, inability to cooperate with examination or anatomical deviations in the head, neck, digestive tract. Some of those things are, you have to get approval before you can do it on anyone with those.
Mhm.
But are they the same kind of, I know different procedures, different process here, but like, are any of those kind of things we should be looking at right now where that should still be outside of the scope for?
I think it should be outside of the scope, honestly, for a SLPA. Yes.
So people with those items as well.
Yeah, I think so. Especially if there's no education in the curriculum as well
Mhm.
right now. I'd say leave these to the SLP.
So it sounds like, um, we're looking at maybe doing regulations. Would you like us to start drafting text, or do you still want us to can have a discussion for next time?
I think drafting text to at least get something initiated would be very helpful. And then concurrently having conversations with community colleges as well.
All right, it's been noted.
Okay.
Public comment?
At this point, do you want me to ask for a motion? And
I don't
then,
think you need a motion for it, but public comment for sure.
okay, so I don't need to do the motion for this one. Okay, for you to draft. Okay. So I'd like to ask the moderator to open public comment on WebEx at this time.
We are open for public comment on agenda item 3. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand. And as a reminder to our mobile device users, you may need to hit the ellipses button, that's the ... in order to find your hand. We're going to wait just a few seconds to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the agenda?
Yes, thank you. And close public comment. All right, okay. Moving on to, I'm okay to move on to the next agenda, item 5, correct? It's hard not to see people.
4?
4?
Okay, 4, yes. Discussion of possible action to amend regulations regarding general application requirements and speech language pathology and audiology aid requirements as stated in Title 16, CCR sections 1399.151.2 and 1399.151.3, 1399.151.4, 1399.154 through 1399.154.12, and 1399.157. So I'd like to ask Ms. Lorenzo to present this agenda item at this time.
Thank you, Ms. Dominguez. On November 30th, 2023, the SLP Practice Committee directed board staff to amend the drafted proposed regulatory language that will implement statutory changes for SLP aids. The SLP Practice Committee reviewed and discussed the proposed text at its December 5th, 2024 meeting and asked board staff to determine how many SLP aides are registered with the board and if there has been any request for alternative plan of supervision. As of April 7th, 2025, the board has 56 SLP aides registered with the board. Board staff inspected applications of SLP aides registered in 2024. There were 26. Of those 26, 11 requested alternative plan. The level of supervision varied, with 16 receiving immediate and direct supervision and 9 receiving direct and indirect supervision. Immediate supervision was used to mean the supervisor was in the same room as the aide when assisting with patient care. Direct supervision was used to mean the supervisor was in the same facility as the aide, and indirect supervisor was used to mean the supervisor was not in the same facility as the aide. A sample of plans submitted to the board can be found in attachment A. The only changes we made to the proposed text were the ones that the Audiology Practice Committee made on December 5th, 2024. And then we have questions regarding does the committee wish to keep the current definition of or the current supervision requirements for aides, or does the committee wish to revise it or in any way?
Can you remind us of the 11? Were those requested alternative plans all approved?
Some were approved and some were not. Many were modified,
Modified, okay.
but we gave you what they originally submitted
Yeah, oh, that's, okay, I did
so
read all
that you
those.
can
So,
see what's being originally submitted.
yes, and then the modifications, did they allow for the SLP to not be present, not be physically present within a,
When there was treatment being provided or therapy being provided to patients?
yeah, yeah.
Trying to remember. Some of it was direct, as in on-site.
Okay,
But I
And
don't,
some immediate, but
Yeah.
not indirect. Indirect was mostly cleaning up
cleaning,
or
clerical.
yeah,
And some of these, you'll notice that some of them actually don't use those words. You'll notice they use words like under the supervision,
Under the direction
under
of.
direction.
yes. Mhm.
That is one thing we did notice that could cause confusion as our analysts are reviewing the application, because it doesn't specify, well, does that mean in the room or where it's at, unless you like read the whole statement. So there is that inconsistency in like words to use and how to describe where the supervisor's at.
It's also a free-form text box, so people, and as well as uploads. So there was quite a variety, and sometimes there were little pieces being slipped into the bottom part or in different paragraphs. It was actually very hard to piece together if you were trying to get a one-for-one comparison of the duties and the training and the supervision for each of said duties or tasks. So it was just technically difficult to review often because the way the current application has been made for many, many moons is just kind of an open box for them to fill in.
That's helpful.
So then you had all these different terminologies going around, none of which match up not none, but many of which did not completely match up with our definitions of immediate, direct, and indirect.
And for each of the sample, I did provide like if we were able to determine where they were working. We did find one where they applied as an aide, but then soon after they applied as an RPE. Again, because the lack of clarity of the word, and as well, I mean, yeah, the lack of an actual definitions for them to use. Staff wasn't able to see like that's what they were. Sometimes they'll put education, which kind of triggers like, oh, we need to see if they're working outside of scope, but not all of them will include that.
It was pretty difficult to dig through, in all honesty, just because of the way it's allowed to be submitted to the board. That's something staff have definitely noted that, you know, oftentimes, right, form follows structure, right? So, you know, if we set up the structure for them to better input this information, then it should be easier for staff to really see what are they asking in this alternative plan? Or is it an alternative plan, or is it the basics, right? Some of these had some very simple, basic and common themes, right? Let me go back to the beginning. Clean equipment and treatment spaces, right? Before and after sessions, prepare liquids, clean materials, collect training material or therapy materials, this in the room while therapy is being provided, relay information, the SLP, what is it? Cleaning the room, toys, materials, math, sensory, gym, that kind of verbiage. Yeah, but there's quite a variety. There are some themes we did see throughout, but there's quite a bit of variety when it comes to SLP aids and what duties they're talking about. And some that literally, it looks like they were just mid on their way to being licensed as an RPE or a SLPA, and they were just doing the aid job in the interim while waiting for that degree completion or whatever. So that was an interesting takeaway as well to see, oh, that's the same person that's over here. Wait, hold on.
Yeah. So with the preparation and the cleanup, you know, that they don't need to have that supervisor to be physically present, right? But this statement that you're putting here, 1399.154.2C, is pertaining with assisting with patients, right? Unless alternative plan supervision. I mean, does having that caveat in there make it I guess give you more of an opportunity to look at plans that, again, how you noted here that someone's working out of scope versus in scope. I mean, giving the opportunity for a supervisor to submit a plan and you looking at it sounds okay to me. You can deny it, or you can modify it, or you can approve it.
I think the difficulty is when most alternative plans are in order to do SLPA function.
Okay.
My only thought being, we all, that this is the difficulty. There's such a small population. It's hard to get a whole lot of input. I don't have very many people that provide us input on what else they want them to be doing. Because there's just not a lot of input.
So basically you would either approve it or deny it.
Yeah.
And not modify.
Or ask them to modify it.
I'm
We
sorry?
also ask them to resubmit it, so to modify it and resubmit it. But that does take, it's a little bit of a back and forth. I think,
Yeah, I do
to some
recall
extent-
this, and I do think, yeah, I do recall us saying that addressing this alternative plan can cause an issue. So having a more straightforward, I can see how that would make sense.
I think it's also worth mentioning, I mean, the aid regulations predate the SLIPA regulations, right? Because we had aid before we had SLIPAs. And a whole lot of the time, we also don't say these are clearly outside of the scope of an aid, right? An SLP aid should not be doing ... right? Go ahead and submit your alternative plan of supervision with the caveat that, hey, these items, because the SLIPAs have a section on outside of the scope activities, which, you know, we just touched on one of them, right? But aids don't really have that. They just have, it's very little context, so that supervisors are essentially just tossing in the kitchen sink of what all they want them to do, and then we have to parse through and say, yes, that's allowed, no, that's not allowed, or this is allowed, but not at that level of supervision.
And you're already, so in a sense, you're already providing that guidance and that feedback, right?
in a back
So
and forth.
exactly,
To some
yeah,
extent, but it is in arrears instead of in
Right.
advance.
yep.
So if we were even more clear about what an SLP aid can do or cannot do, then it might be even easier for them to say, oh, well, that's not what I want. What I really need is slip up, right? Or, oh, I totally need that, but I don't need to ask for an alternative plan of supervision because the only things that I alternatively want them to do are outside of the scope. So that's where it can be helpful.
Okay, so that leads to the question, do we want to keep this requirement or revise it to remove the option of requesting approval of an alternative plan of supervision? So we can pose to remove the option. We're okay with, are you okay
Or
with
you
that?
can keep it, either.
Oh, I'm okay removing it.
Because I
Emma?
think it's almost even clearer that aides don't get to do, if you're wanting to be extremely clear, it's very much clearer if you're saying, hey, SLP aides, there is no alternative plan when they're assisting, when they're assisting with patients, there's no alternative other than being in the room.
Right,
Exactly.
I agree.
Because I think that's also the question mark, right? Is there anything they could or should be doing with a client, with a patient, when the SLP is not in the room?
No, because
Yes.
then they could start.
Then they'd be a
doing
slipper, right?
Right. Stay within their scope.
That may be a great question, and it also might be something that the field might want to weigh in on. You know, are there certain forms that aides have the patient fill out, and is that okay? I'm trying to think of like intake questionnaire or something like that. I don't know if the aide does that before they get in the room. So they're working with the patient, but really only to gather the intake questionnaire. I'm probably saying it wrong, but you know what I mean? Like when you first patients coming in and you have.
That's proper intake, that's right.
Okay. And then, so, you know, maybe that is something, but and that's where I hesitate, and it would be nice to have some of the supervisors of aides to kind of chime in on.
Try in the public. I think though that when you're doing a questionnaire, if someone has a response, that leads to follow-up questions that someone such as a SLP would be able to ask, you know, those questions, those follow-up questions, right? Versus in intakes, it's not just a yes, no, it's sometimes a when and a how. And how does the behavior look? When did it start? Things like that. So there might be follow-up questions if they're asking those, and they shouldn't be doing that, or they might not even know what follow-up questions to ask.
Right.
So I'm not quite, I don't,
Still stays with the SLP then.
yeah, I
Okay.
think so.
Just trying to think of all the alternatives.
Because there might be further probing questions that need to be asked after an initial question is presented.
And I think one of the things that's, not as part of the questions, but it is part of what, now that we have seen what the results of the way we format the application leads to kind of the way we get the question or the
Responses.
plans and the responses, maybe that can also help clean up what we're doing if we change that.
Because you would either approve the plan or tell them to,
Modify.
yeah, modify it, right?
Yeah.
So, yeah, that makes sense.
So you want to leave it there and then we can just approve or modify?
Approve or modify. Right.
Okay. Keep the requirement. And then, the part of considering defining some of the words, were we thinking that just needed to be actually in the application, like immediate supervision means this, this means this, or were we thinking maybe the committee needs to define more of the duties?
No, yeah, so the committee can decide to define like immediate, direct, and indirect for the purpose of supervisors to use that when they're filling out their application. So that's a little bit more structure in the narrative.
Similar to the SLIPAs.
Yeah, because right now everyone's using different words and they can be a little vague and too broad. So that is one approach the committee can also address the issue, is that to require that in the application they use these terms when talking about the duties.
Is there a way to build into the application some asterisks of, if you're going to say this, we're going to reject it. If you're going to add this, this is not going to work for the scope of practice or anything like that, so that there's a little bit more clarity even when the initial application's being submitted?
I think that's where I was kind of going with, if we made a section that said these things are outside the scope of an aid, then it's, you clearly say, please specify the duties, and then you also say, that comply with the other laws and regs.
Yeah, we could do that, but it would all be done through regulations, so we
Yeah.
would have to
Mhm.
drop text for it.
And that's where I just don't know if there's a whole lot that it's worth doing that, or if it's just.
Sure.
So consistency is always good. So I think including the level of supervision and the defining words would be helpful. So everyone is consistent in that guidance.
It was very much all over the map.
I was reading that. Yeah.
There were some that were quite jumbled, some that were just a little bit typed into one box, nothing typed into the other box, except for a comment on one. You don't know which one of the duties it is. Some people were very organized. It's 1 through 8 and 1 through 8, but it was
Yes.
rare bird. So.
So in that case, so when we're looking at the language here in 1399.154.2C, 2C, be physically present, that's immediate supervision.
Yes.
Yes.
So the provide, it would, so we would have to change that to say provide immediate supervision while the aid is assisting with patients.
Yes.
Unless an alternative plan of supervision has been approved by the board. And the only alternative plan of supervision would be direct supervision, unless you think there's time that indirect, which is meaning that the supervisor wouldn't be there.
I think they're saying there isn't though.
There isn't, no.
Right.
There's
Take that
time
out.
that you're with the patient.
So yeah, so that's, so.
Okay, so we want to remove that.
So we would either define alternative plan or just
We're saying immediate supervision while the SLIPA is assisting with patients. And,
Period, right?
and strike the rest.
okay. And then I guess we could say direct supervision can be provided in other times or something like that. So when they're not with the patient, they can, the supervisor can walk out of the room.
Yeah, you're talking like when they're preparing, when
and
they're setting up.
prepping.
Yeah, that's what I mean. Yeah, like preparing or cleaning up. That would be
Yes.
the direct supervision.
Yes, we want them on site somewhere. Direct.
You want to add it there too and see.
Yeah, I think it'd probably be best to just add it there and then
Yes.
then we could just define
Mhm.
what each one means.
Okay.
That way they can use they could use those words as they're
Yes.
describing what duties for each duties,
Yeah.
what level of supervision
Yes.
are you.
And everyone is consistent with it, yes. And it's easy, it would be hopefully easier for the staff to review these and either approve or or request the modification.
Yes, that's correct, because they're doing, not only are they analyzing the level of supervision, but they're also analyzing the duty, if it's within or outside of scope. So it probably will help. It will definitely help
Yeah.
if common language is used for supervision.
Yes.
The lack of common language was definitely a difficulty in looking through these.
Oh, yes, consistency is key.
Okay, so it sounds like we might need to make some more amendments and bring them back to you then.
Yeah.
Okay. Thank you. Thank you for your work on this.
Welcome.
And just really quickly, on the memorandum page, on the summary of changes, it's not the audiology practice committee met on December 5th. It would be the speech language pathology practice committee.
Yes.
Oh, you both met that day to talk about it, but yeah.
Oh, I think it might have been September actually.
But it's for the audiology practice committee that it.
Yeah, the audiology practice committee already approved the text.
Got it,
We're
okay,
just waiting for this committee to approve it.
got it, okay.
It was either September or December.
Oh.
When they met and approved the language. My
And then you
apologies
approved
if the dates are wrong.
Oh, yeah, while we're there, can you look at SLP 3 and under background, look at the December 5th date, add it's December 5th. If we can just confirm that date as well. Under SLP 3, page 1 of 2.
That one I think is correct.
Yeah, I think that one's correct.
Didn't we just recently talk about this though, as well? And asking about looking at neighboring states?
Yeah, that was December.
That was December.
This past September.
Yeah, this
Yeah,
last December.
we looked at it.
So that should be 2024.
Yeah. Oh, you're asking about the first one.
Yes, sorry, I went back to the first one. Since we were talking about dates.
Okay. Mhm. Y'all take a look at the minutes.
Okay,
One says November 30th, 2023, and the next one is December 5th, 2023.
but I think we talked about it at our December 5th, 2024 meeting. I think, right?
Yeah, we talked about it last year, just not sure if it was the September or December.
Okay, thank you.
But it's audiology document.
Okay, shall I move on to agenda item 5?
Public comment?
Oh, sorry. It's so hard when I can't see you all. Throwing me off a little
And
bit
this is
today.
for Council Yuping Lin. There continues to be no public members in the Sacramento location.
Okay, and we don't have any here at all either. So I'd like to ask the moderator to open for public comment.
We are open for public comment on agenda item 4. If you'd like to make a comment, please raise that hand by tapping the hand button at the bottom of the screen. Mobile device users, you may need to hit the ellipses button, that's the ... in order to find your hand. We're going to take a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the agenda?
Yes, please, thank you. Okay, now moving on to agenda item 5, discussion and possible action to recommend amendments to requirements for continuing professional development for speech language pathology assistants as stated in BPC 2538.1 and Title 16 sections 1399.170.14 and 1399.170.15. Excuse me. I'd like to ask Ms. Burns to present this agenda item.
Thank you. So during the course of auditing the continuing professional development records of board licensees, and specifically the speech language pathology assistants of the SLPA, board staff has had to educate current SLPAs about the limitations of the acceptable types of continuing professional development that they're allowed to accrue. So many were not aware. And then during this process, staff also had the question marks because, you know, they're also learning our laws and regs in the process and upholding those standards. They had the question as well, you know, well, why is it that the speech language pathologist can take these kind of coursework, but the speech language pathology assistant can't take this coursework? And it ignited a very good conversation of what limitations are there. Are they maybe a little too narrow? And then the question of whether or not, since we're going up for sunset next year, maybe that should be something the board would want to look at as an opportunity to expand that. So Business and Professions Code 2538.1 B6, it states that the minimum continuing professional development requirements for the speech language pathology assistant not to exceed 12 hours in a 2-year period. The speech language pathology assistant supervisor shall act as a professional development advisor. The speech language pathology assistant's professional growth may be satisfied with successful completion of state or regional conferences, workshops, formal in-service presentations, independent study programs, or any combination of these concerning communication and related disorders. So the board then took that language and then essentially put it long ago into the regulation. So it's a tiny bit conflictive there. And then we just have them certify in writing under penalty of perjury, in 1399.170.14, that they've completed the 12 hours. But again, it's only allowed because the statute defines it narrowly through state or regional conferences, workshops, formal in-service presentations, independent study programs, or any combination of these concerning communication disorders. So SLPAs can only do those lists, right? State or regional conferences, great. Many people used to always get it that way. Workshops, that's especially helpful in a school district, but maybe not in a private practice. Formal in-service presentations, again, we're talking about maybe a school district, maybe a bigger clinic, but maybe not if you're working in a small clinic. Independent study programs, which I would point out we didn't really clarify. What does it mean? Does it have to be a formal independent study program? Can it just be the supervisor saying these 12 courses on speechpathology.com? What does it look like? Or are there any restrictions on it? And then any combination of those. But when it comes to the SLP or the SLPA supervisor, you can also take courses through accredited institutions of higher learning, coursework from ASH, American Speech Language Hearing Association, American Academy of Audiology, California Medical Association. So these folks get a much broader, as well as professional development providers approved by the board. So there's a much broader array of coursework that's available to the SLP than it is the SLPA. Now, mind you, of course, if your SLPA is taking continuing professional development, it should be related to what they're doing, not to accrue the necessary degree requirements to become an SLP, not in order to do things outside of their scope of practice. But there's plenty of coursework out there, I'm sure, that SLPAs could benefit from in their practice as an assistant But right now, those levels and those types are not allowed. So the question board staff has is, as we prepare for the sunset review, the committee may wish to propose legislative changes if it finds that SLPA should be able to fulfill their CPD requirements from other providers and through more diverse course type options. And of course, this would have, because the statute is narrow, you can't make a regulation that goes against the statutes and says, no, we can go ahead and do it in all these variety of things. You have to actually address the statute first, and then clarify in regs. So that's why we thought it's a good time to have that conversation and see what the committee and then the community thinks SLPAs could benefit from in the CPD realm.
May I ask why initially these other areas were excluded as learning opportunities?
I do not know. I think they were developing it at a time when, again, remember back in 99, 2000, 2001, online courses weren't the rage, right? I mean, I'm going to date myself and just tell you that after that, I was working on creating DVDs to train, board members and things like that. And that was the cutting edge thing, because websites just had some information on it. They didn't have online courses to that extent back in those times. So really, when they were defining it, those were kind of the ways people were getting most of the information, but I am not sure why they thought maybe don't do the coursework. Maybe there was the concern, oh, they're just going to be getting the coursework to become an SLP. But you could also put restrictions on that, right? Sorry, just like for speech language pathology and audiology, you as a licensee can't take a course on ankle fractures and tell me that it counts as a course related to speech language pathology unless you define and tell me exactly how it relates to your practice as a speech language pathologist. So part of CPD regulations is that, yes, you can get it in all these formats and in all these methods, and then the regulations would tell you, but they still have to apply to this, right? Or it can't just be the coursework to get your leveling courses for the SLP program. It needs to relate to the practice as a SLPA. So, but I think at that time, again, these were kind of the general options. And again, SLPAs were envisioned to be in schools providing therapy to kids. These would have been pretty formal in-service presentations and workshops at your district, right? Those were right in line with where they thought those people were going.
Yeah, I think if they're able to, a lot of these you have to register or pay for, like for ASHA. If they're able to do that, I think that would be a good opportunity for them to take courses from ASHA. The state or regional conferences, so I do see them at the California one, so that's already there. But ASHA, I think, would, as long as they're able to register and there's no exclusion statement, that they're not able to take it for some reason, I think it would be good to consider allowing them to be able to take coursework through an organization approved CE provider.
I agree.
Including online.
I'm curious if the other CPD providers, I would assume well, I guess that's the question, right? Are any that the SLP is allowed? The SLPA should be allowed so long as it relates to their work as a SLPA?
I think it needs to be appropriate, yes, to wherever they're working, their site or the population that they're serving. It's supposed to be of a benefit to the clientele they're working with, the clients they're working with, right? And their skill set and their knowledge.
And then when we allow the coursework, or if you allow college coursework, would we restrictions potentially on, obviously you're not taking them towards your master's degree or something like that. It's actually related to your practice as a SLPA. That where we'd want to kind of draw the line.
I think so.
Mhm.
What do you think?
I agree. Yeah, I think so too. Yeah, I agree.
I mean, it keeps with the concept where we kind of don't allow double dipping most of the time.
Yeah.
Mm-hmm. Then I think we should stay consistent.
Yep.
Okay. Well, that answers all of my questions. So what we can do is bring back some recommended language next time if you'd like to direct
Yes.
to do so. Or you can just say be so directed.
Yes. Yes. Be so directed. Sorry, you're cutting in and out to me.
Oh, no.
I didn't hear all that. So at this point, we'll open up for public comment.
We are open for public comment on agenda item 5. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. For our mobile device users, you may need to hit the ellipses button, that's the ... in order to find your hand. We're going to take a few seconds to see if we have a request for public comment. Seeing no request, do you wish to continue with the agenda?
Yes, please. Thank you. Okay, since that is the last item on the agenda, we will go ahead and adjourn the Speech Language Pathology Practice Committee meeting at 4:54 p.m. And we will also close out the meeting for the day. And again, thank you. Thank you, board staff. Thank you, everyone who's attended.
Thank you.
We'll see you all tomorrow morning at 9 a.m.
Thank you.
you.